Thank you, Mr. Speaker. The Health Minister needs to come clean with Albertans. The Alberta Health Services provided preferred access to a health care service to an individual at a private for-profit clinic, apparently as a recruitment strategy and to expedite her immigration status. Is that what the minister is saying? And how is that not queue jumping? How is that not two-tier private health care?
First of all, Mr. Speaker, let's start with the facts, which is not what this minister said. What this minister simply said was that there was an employment contract in place that did permit a person who we recruited in order to work and manage a very large healthcare system to see whether or not they could settle in Alberta, Mr. Speaker. That is all that the minister said, and any other characterization is false.
I believe it. Speaker, these bills are for health care services from a doctor. Yesterday, the Health Minister told the House that queue jumping at the taxpayers' expense by Alberta Health Services executives was a thing of the past. He said this situation could not happen and is not happening in Alberta today. Today, we've learned that it's not a thing of the past, Mr. Speaker. It's still happening on this Health Minister's watch. To the Premier, how can Albertans have confidence in a Health Minister that denies queue jumping at taxpayers' expense is happening when it is?
Would have confidence if they actually listened to the false structures of these questions that draw unequal parallels, Mr. Speaker, that characterize completely different fact situations as being the same thing, Mr. Speaker. It is not appropriate. The information with respect to the question asked today will be provided, and this minister has never misled the House.
Mr. Speaker, well, the Premier's lawyer double talk's not going to work this time. This PC government can't be trusted to protect our health care system. In public, the government assures us that they support universal public health care, but behind the scenes, senior health executives get preferential treatment from private for-profit health care corporations. It looks a lot like private two-tier American-style health care to me, Mr. Speaker. How can Albertans have confidence in a government that permits preferential access to health services paid for by taxpayers for its senior officials?
Mr. Speaker, the reason that Albertans can have confidence in how this government provides public health care, Mr. Speaker, is we're committed to it, and I don't know where I was on Monday compared to everyone else. I was standing in Calgary with the president of the AMA signing a 7-year employment contract with